Assalamualaikum warahmatullahi wabarakatuh. We, from Group 4, will be presenting about paranoia, specifically about the delusional disorder. My name is Norsyahirah Binti Faisol, and my matric number is 1200127. The fact that we will be explained today had been discussed with a psychiatrist from a government hospital located at Kuala Pilah, Negeri Sembilan. About the delusional disorder. Delusional disorder does exist in our country but aren't common to be happening in Malaysia, like schizophrenia, mood disorder, eating disorder, etc. This illness was labeled under the psychotic disorder, and a diagnosis are needed to detect the illness on the patient. The diagnosis was done based on the Diagnostic and Statistical Manual of Mental Disorder, also known as DSM-5. The illness was decided if the symptom kept showing for a month. Delusional disorder was divided into several types such as psychiatric, referential, grandiose, erotomania, realistic, and jealousy delusion. Different from schizophrenia, delusional disorder rarely had any hallucination.
Okay, let's take a look at the definition of delusional disorder. Delusional disorder is an unwavering belief, despite evidence that stated that their belief is false. Okay, according to Harvard Medical School, delusional disorder is classified as psychotic disorder, where a person has trouble in differentiating between reality and non-reality. Okay, for example, people with delusional disorder might hear people talking to them, but in reality, she or he is sitting all alone. Okay, meaning there are no friends meaning there are no humans surrounding them. Okay, also schizophrenia and delusional disorder has differences between them, which is delusional patient is not as severe as schizophrenic patient. There are 3 factors that can contribute someone in having delusional disorder. Firstly, genetic. Okay, it is very common for someone who have family members with delusional disorder. Okay, and the tendency of people who have this disorder might be passed on to the next generation or to their children. Okay, for example, parents who have delusional disorder can pass on these genetic factors to their children. Okay. Secondly, psychological. Firstly, psychological environment. Okay, people who have experienced abusive household, traumatic childhoodness. Okay, so the delusional disorder came to for someone to cope with their trauma. Okay, for psychological mind, okay, it has this imbalance of chemicals or abnormalities in their mind or in their brain can play a part in delusions. Lastly, substance use. Okay, substance use such as drugs or anything else. People who have history of using substance use might as well can develop this delusional disorder because they are likely to have severe delusions due to the effects of the drugs or the substance use, and this can result in longer and worsen the delusional disorder.
My name is Najmina Binti Zahir. My matric number is 1200145. There are 3 methods of treatment used by psychiatrists to treat patients with delusional paranoia. The first is biopsychosocial model, which is actually stands to 3 terms, which is biological, psychological, and also social. So, in understanding health, illness, and healthcare delivery, the biopsychosocial approach takes a systematic look at biological, psychological, and social factors as well as their complex interaction. According to the psychiatrist we spoke with, this model is typically used to determine the causes before diagnosing a patient with any related diseases. Next, For the example, the psychiatrist state that people who have an alcoholic use disorder frequently struggle with jealousy delusion. Using this biopsychosocial model, we can identify additional causes that contribute to this paranoid delusion. Next, we go to the second method, which is pharmacological treatment. The psychiatrists we interviewed explained that they will typically use antipsychotic in treating patients with delusion. Example for delusional medication are atypical antipsychotic risperidone, olanzapine, acetaminophen, and others. There are also many kinds of medication that I'm not stated, but also can help in assist people to cure their delusional problems. There are also first generation antipsychotics, for example, haloperidol, that are common used by atypical groups. For your information, antipsychotic is a class of psychotropic medication primarily used to manage psychosis, which is including delusion, hallucination, paranoia, or disorder, or other disorder, principally in schizophrenia, but also in range of other psychotic disorder. Next, the third method is non-pharmacological treatment, which will include psychotherapy education, non-directive counseling, and other techniques to assist patients suffering from delusion.
Okay, next we go to the period of treatment for this disorder. Okay, firstly, there are actually no definite period of time in order to treating a patient with this disorder, as they usually show a less response to medication that has been given to them. But based on the doctor's experience, patient with this disorder usually takes around 2 to 5 years to get better, and sometimes the disorder will go away even without the help of any treatment and medication. Okay, next we go to the psychiatrist's perspective on this disorder. Based on the doctor's perspective, cultural background can actually give strong influence on patients, like they claim someone sent santal or bad things to them, so they go to the Sami or shaman to get treatment. Okay, secondly, most of the patients with this disorder, they are actually under two types of delusion. Okay, firstly is prosecution, where they actually believe that someone make the delusion in them, like the neighbors or family or friends or even enemies. Okay, second, grandeur, which they actually believe that they are the chosen one, that they are God or prophet or someone that has the power among their society.
Then, we look at treatment from an Islamic perspective, especially for delusional paranoia. The biopsychosocial and spiritual model is a holistic approach that acknowledges the interaction between physical, psychosocial, social, and spiritual aspect to patient care and also patient well-being. According to the psychiatrist who was interviewed, this spiritual will help the patient in his or her healing process, especially to the Muslim patient. This is because this kind of approach is more in spiritual element. This is because it is true that humans are dependent on Allah subhanahu wa ta'ala, particularly those who are believe in Him, especially we as a Muslim. Dependence on Allah subhanahu wa ta'ala is a must for those who embrace Islam because it is natural in human life. For Muslim, any problem has a solution that has been predetermined by Allah subhanahu wa ta'ala, and also the spiritual help is one of the prioritized thing in Islam. According to Islamic perspective, one of the treatment given to patients who are suffering paranoia with delusional disorder is the biopsychosocial and spiritual model. This is because this model not only focusing the biological element, psychological element, and social elements only, but there are also religious, which means spiritual elements. In the spiritual elements, we are encouraged to getting closer to Allah subhanahu wa ta'ala, do the deeds commanded by Allah subhanahu wa ta'ala, and living the way of life that are misleading and neglect, which can help person, especially Muslim, to build confidence and also a personality in the face of any challenge in their life, especially for the Muslim. Worshipping Allah subhanahu wa ta'ala can bring us closer together and fill an empty soul. Prayer, reading the Quran, fasting, and other forms of worship are permissible to help Muslim getting closer to Allah subhanahu wa ta'ala. There are several Islamic methods that are recommended to aid or assist in the recovery process for the person who are suffering from paranoia, delusional disorder. These include prayer-based treatment based on the Quranic verse or Quranic recitation therapy and other spiritual treatments that can help provide the heart of a Muslim who are facing any kind of problem in this life, especially to the person who are suffering in paranoia, delusional disorder. Thank you.